I'm telling them I don't want them. I'm not listening. I want them to get, hi, I'm here.
Sorry, Dr. Johnson? Are you present, Dr. Johnson? Dr. Johnson?
And Okunde. No, he's not here. He
Okay.
got off line. I think he didn't think anybody was on that, because we both were on that block. We didn't hear anything.
Okay. He may re-enter if you'll
Oh.
contact Dr. Johnson. Okay, you have a quorum, Dr. Moore?
All right, without Dr. Johnson? We have a quorum without him?
Yes.
Okay, great, awesome. Item 2, public comment. Do we have any public comment at this time?
None in the north.
None in the north, none in the south. All righty. I'd like to move to item number 3, which would be to approve our agenda.
So moved. Second, Sanders. Wesby, primary.
Any discussion about that? All in favor, aye.
Aye.
Opposed?
Pretty sure.
I believe that passed, but did I miss anything? Yes? Okay.
Nope, you're good.
Great. All right. New business, item 4. I would like to review and discuss the recommendations, item E first, agenda item E, please.
Okay.
And this is regarding the application to become a recognized provider for moderate sedation. It's a course from Augusta University Dental College of Georgia. But Dr. Johnson is not available. I had a chance to look at it. It looks fabulous. Did anybody else have a chance to look at it?
I looked at it, I thought it was very thorough. It's actually more thorough than some of the other programs
Right.
that we've approved, I think.
Yeah. Yeah.
And I know.
I looked through it. This is Amanda Okunde. I looked through it, and I just have a little more information just because I looked through the course and I've been looking through it. I have some of their paperwork from 2011 till now. Very good presentation. I would say that we just need to look at the anesthesia records. The course itself in the past has taught propofol to moderate sedation providers. We've had a couple of course participants take other courses at USC and at Oregon who their states did not accept their anesthesia records because it has propofol as one of the sedative drugs that were administered for moderate. So we'll have to look at that closely, or ask them if they're still teaching that medication. The only other thing is that I do know that they don't do the dentistry. They only administer the medications for the oral surgery residents, and so they're not in the process.
Oh, I think Dr. Johnson is here.
Dr. Johnson, thank you for calling in. Dr. Kunde was making a statement.
Right, so, and Dr. Johnson and I have spoken about this as well, so that they're not doing the dentistry, and so they're not participating in the case from start to finish. And so I think that that's something also to look at from a course participation standpoint. So I couldn't find this email. I was actually telling Dr. Johnson I do have an email from one of the participants who was not accepted with their anesthesia records. I believe in the state of Florida, they're pretty firm that they saw propofol in there, and obviously that's a general anesthetic drug, so they did not accept their anesthesia records. So, you know, that's something that we'll have to ask. That's not something that I have in front of me, but just so that you are aware of that.
Would you recommend then that potentially tabling this until we have more information, like you've requested, those anesthesia records, etc.?
I just feel like he should just, yes, I feel like from the director, which, again, he should be forthcoming on what medications they teach. That was not in there. So if they're just teaching the midazolam fentanyl, it's understandable that are, moderate sedation drugs. But if we could get a list or something, not just arbitrary, what you already spent, and we actually find out what they're teaching, that would be ideal. But we also want to find out if they're actually administering and starting and finishing the case start to finish. Because if you just give a drug and then walk away, that's not really understanding the moderate sedation aspect, because then somebody just comes behind you and gives more sedation or sleep or induced sedation. So we just need to know the actual process of what drugs they're getting.
Right.
Well, can we just deny it instead of tabling it? Just say, it's denied until they can come up with what meets our standards. Let them do the work.
Okay, whatever you guys suggest.
Well, do I have a motion for either of those then? Dr. Johnson, would you like to make a motion, sir?
I'd like to make a motion to deny the application until they meet the standards of Nevada.
Do I have a second?
Second, Joshua Sachs.
Okay.
Discussion? All in favor?
Aye. Aye.
Any opposed? All right, motion passes.
The point is they're over drugging
All right, items,
quite frankly.
items A, B, C, and D. While they're different, they're reviewing and discussing similar items, potentially changing some regulations. And I'd like to open comment for the four of them. With the first comment I'd like is to hear how, or not how, but the reason for having these items on our agenda today, please, from whom? And maybe that would be best from.
So as you know, we changed the regulations. So we now have a pediatric moderate sedation permit. And so there was discussions prior to develop emergency scenarios for pediatric patients to update the emergency scenarios for moderate sedation for 13 years or older, and also to update general anesthesia. My understanding is that some of the subcommittee members felt that after these changes that our emergency scenarios may be outdated. So that's why this was put on there.
So there were subcommittee members from last year?
Right, when we were doing the once we finished the regulations that the subcommittee had developed, then it was noted that the emergency scenarios needed to be updated to reflect the changes, and also some of the scenarios were outdated, or there may be other medications that could be used, or whatever the case may be.
Twesney here, do you have a goal of having a separate set of scenarios for 12 plus and 12 minus? Is that what we're thinking about?
Yeah, that's what they were thinking about.
Probably a good idea.
This is Joshua Sachs. My concern was to standardize the examination, especially for litigation purposes. I think we all should be on the same playing field. So many of these scenarios that we have right now, they'll say a 7-year-old boy comes into an office, and it's still the same scenario, but we can just say it's a 15-year-old boy coming to the office. We're using oral sedation today. Today, for that 7-year-old. For that 15-year-old, we're using IV sedation. So it could really be the same question, but the parameters and ages can be different. There are some other scenarios that we could come up with for general anesthesia, I understand that, but for moderate sedation, pretty much the same. I mean, unless we're changing the NEC, I mean, we do laryngeospasm, all the several different scenarios. We're still testing on that, whether it's 13 or older or 12 and under, they're still the same scenarios. Yes, we can change the ages and the scope of the meds that we're using, but I think to protect all the examiners, I think it should all be the same question. So then that one person says, well, I got a harder question than this doctor got. That's why I'm thinking to recommend to maybe table a lot of this until we can have a sit down and to calibrate and talk about this together as a whole before we start agreeing to changing the different types of scenarios and things of that nature. And then, Deborah, if you can just discuss like D to us, because I didn't know that until you told me about that. I don't know if the other members of the committee understand what.
So we had an audit done by the Division of Internal Audit, and one of the recommendations was that they wanted disciplinary screening officers, infection control inspectors, or evaluators for anesthesia to either be employees or independent contractors. And for the anesthesia especially, it would be very difficult for the board to employ that many and also to track the hours because somebody might cancel their inspection, and so the only other route to go would be as an independent contractor. But as an independent contractor, then you would have to enter into contracts with the board.
And they would have their own independent liability that, yeah.
Oof. That's a biggie. But that's something.
Can I go back to this is Amanda Okunde. Can I go back to what Josh was saying really quick? I just wanted to co-sign what he said. I think that it'd be nice if we calibrated as a group and then we come up with 3 different group of scenarios. Exactly what Josh said, we can do this similar scenario, but a peds oral moderate sedation provider, we should not have to worry about quizzing them on a word spasm because they're never going to have that because they have a conscious patient. And so we can use those scenarios, just change it to who we're examining, but we as a core group have to calibrate first because peds oral moderate sedation is going to be different than IV parenteral moderate sedation, different from general anesthesia. But if we're all not on the same page, it doesn't matter what our scenarios are, it's not, if that makes sense. So.
Absolutely.
And then just on that accrediting company, I understand that you want to use an outside accrediting entity. I do know the AAFD. The only issue that I would take with that situation is that everything that they do is through video and teleconference. I think that it's really important that we're hands-on as examiners. So I understand the internal audit suggested that. I just wanted to share that I think it's really important that we go in there, tangibly see things, tangibly look at them, and as you know, we also are going to look out for other people within our state, where this is a for-profit company, and $3,000 is very expensive for everything through video through that company.
Twesney here. I've sat on a committee. I'm sorry, Amanda. I didn't mean to cut you off. Did you have more to say?
Oh, you're fine.
You sure?
No.
Well, hi, by the way.
Hi.
Ted Twesney here. I sat on a CDCA, which is the old NERB that now licenses, it'll almost like 47 states now with one license. And we put together an anesthesia evaluation that Washington, D.C. wanted to use, and it's all done by phone. And it's a written test, and then it's just about ready to be wheeled out. I think it might be ready. It must be something we could look at. There's no visitation to the office. It's all done with an iPhone, and you know, you go through the drugs and they have to show you a picture of it live, the expiration dates and your emergency equipment, and then they do the scenarios right over the phone. And so it cuts down on travel expense, and I don't know how much they're charging, but that might be something we might look at and get out of that business altogether.
Right, and one of the things we were thinking of is prior to them applying, they have to have all that. So to get away from these temporary permits, that they do their evaluation and their inspection, and then they make the application to us. Very similar to a dental clinical exam. They take the exam and then they apply for the license or the permit. And then that way, no one would be administering under a temporary anymore, waiting for an evaluation.
The CDCA is, and there's been a lot of discussion about live patients, and I know both sides of this thing. And They are not going to do, observe an IV sedation or general anesthesia being administered. They feel that there's a lot of liability. Amanda's aware of a case, and I am too. She knows more about it than I do, where they were doing an evaluation and the patient actually got into an emergency situation, and the person being evaluated was not responding properly to the emergency. So the evaluators had to intervene and correct the situation. Amanda maybe has more. So there, and I defer to Melanie on our exposure on something like that, particularly with this independent contractor thing. That is a big deal for me.
It could be an issue. I'm not prepared to give a complete legal opinion right now, but I can tell you that it's an issue. The independent contractors would have to have their own malpractice insurance, which automatically makes them targets of lawsuits should something go wrong while they're evaluating. Should they have to step in? And I think that it is definitely an issue for consideration.
This is Joshua Sachs. There's also our NEC that we have, that any dentist that who's on the board that's examining somebody has to have the same permit as that person who's being tested. So that would have to be changed to allow for an out-of-state entity. They would have to either have the Nevada permit and to do sedation, or the NEC would have to be changed to accommodate that.
You know, Ted Twesby speaking. Kevin, if you want, I can call CDCA and give us, I don't know if that thing's ready to grow or grow or whatever you call it, but maybe, I don't know if that takes legislation to change that or not. And you may not want to do it, I don't know. I'm just saying, if you want, I'll call them and find out if that's ready or not.
I think we'd appreciate that and bring it into the
Calibration meeting.
Yeah, well, I think we probably need
And there is someone that's going to do a webinar for the AAFDO here shortly in a couple of minutes. I did kind of explain to them what we were looking for, that, it wasn't going to be, that it was going to be live, that they were going to inspect offices and so forth. The administration wouldn't be going on, but they could do mock scenarios at the offices as part of the evaluation. So I kind of told them what we do now and what we were looking for, and so they're going to be doing a presentation here in about 20 minutes.
Personally, Ted Twesby here. I'm retired, of course, I don't have any practice anymore because I'm there's no way, not that makes a difference, you can find other people, but this would take me out of the ballgame for sure. Because I'm not going to buy malpractice insurance to do about 3 exams a month. And I don't know if I think you're all in or you're all out as an oral surgeon. My premiums were about like $20,000 a year. So
this is Joshua Sachs. Presently, how are the examiners protected now when we're going to people's offices to do their sedation? I mean, how is that protection sits as it is now?
Currently, for discussions with the AG's office, there's a general liability policy which covers all agents of the board, and so there's some protection under there. To the extent that doesn't cover you, there would be protection through the avenues that would protect the board members. But that's all kind of being called into question now. We're kind of in a crossroads right now.
So are we named additionally insured, each individual person in this room right now? Are we on that policy?
Because you're an agent of the board, so every July they ask how many investigators we have, how many board members, how many full-time staff, how many IC inspectors and evaluators. And then that covers all of you. You're not named individually, but we're not either, and neither are the board members. It just covers, as many inspectors, as many investigators, board members, and full-time staff.
And I don't think it's a policy per se. It's a general liability fund, and the AG,
right,
the DAG might be able to explain it better.
Right. It's a state-funded policy. So there is no
It's not a
actual policy. Actually, there isn't a policy. It's a state-funded
liability.
Think of a fund essentially.
Fund,
Yeah. This board is along with numerous other boards and state agencies pay into.
We pay into it per.
So is it still in discussions with being these independent contractors? It sounds like it's still in discussions of the liability being pushed off to the examiners who are doing this. What is their reasoning, do you know?
Exactly.
To do, why do they want to do that?
The audit evaluated certain state contracting statutes, and the auditors felt that our evaluators would fall into the category of those people that needed to be independent contractors. If they were independent contractors, there's another statute that specifically says that you cannot be covered under this state general liability fund. So
Not good.
we're kind of, our hands are sort of tied. We have to determine whether the auditors are correct in their legal analysis, in which case make everybody independent contractors, in which case there's going to be some additional liability.
And
We'll follow.
may
I
lose a
feel
lot of
we
this.
weren't going to have any evaluators. I think that that's going to be a problem. Or we need to look for other avenues to do these evaluations, and that's why we've reached out to this company. And you know, I wasn't aware of that exam, but that would be another. And not to hire them, but to have them explain to you and to the board what it is they could offer as a potential alternative to the board doing these evaluations themselves.
The entire analysis in the audit was about purchasing and contracting. It wasn't about what we do. And they're trying to sort of Procrustean way make everybody fit the bed.
Well, wasn't it specifically about not having contracts?
Correct.
Yeah.
Correct.
So you could contract with you personally, technically, as long as there's a contract.
But
then I
he could,
assume liability.
then he
Yes.
assumes his own liability.
Yes.
And are you willing to enter into such a contract?
Yeah, but so that there's not confusion as to what the audit was saying, that's why I said that.
Okay.
Yeah, and I want to get back to Amanda's points earlier. I guess I want to ask, is there a motion that these items should also be put on a subcommittee meeting so that we can understand what the audit is for the committee members, so we can understand why each of these line items are really on there better, so we can discuss it, and then we can come to the committee?
That's a good workshop of some sort.
I put a motion to put these to rest for now until we can have like a calibration meeting and get together.
Second by Twesney.
All in favor, any discussion? All in favor?
Aye.
Any opposed? Motion passes.
Kevin, would you mind
Could you, we're having a little open meeting law question here. We're a little bit confused as to what exactly you're proposing, as to whether or not you're proposing a private meeting of a subcommittee of the subcommittee.
A calibration.
But
Just a calibration meeting of the committee.
But
Does it make difference called a workshop?
even a
But
workshop
has
is
to
a
be
public
noticed.
meeting.
Is a public
Hold on,
meeting.
workshop.
If you're talking about
Oh, okay.
I'm sorry, if you're talking about developing, because obviously with these new changes too, with the capnography and all of these changes that were made in the calibration that was originally done, I believe, by Dr. Bart Johnson,
Yes.
correct?
Yeah, so in the past, Bart did a presentation. He had it on CD. He's no longer with us. He passed away, but basically do those same things where we, calibrate with each of the state anesthesia committees, whether it's Washington, California, so forth, and we go through each medical emergency scenario. As a committee, we talk about what the new literature says, what the new AHA guidelines are, what the new AAPD guidelines are, and as a group, we come together and we write that down before we come up with our scenarios. And so that way, everybody's on the same page.
So
Well, this would be, I think for clarification, this would be more of a fact-finding session, which I believe
But
is.
Well,
it
the
would
session
be
of this subcommittee.
It would be separating the new statutes, so it would be
They would be all
separating
examined.
moderate oral sedation,
Yeah.
But it would be a
IV,
meeting of the
IV
subcommittee
station,
with
so on
just
and so
additional
forth.
input.
Questioning here again, I don't care, it has to be people you want in here. You want to open
But it
meeting?
has to be open.
That's fine.
Right.
I mean, we got some experts want to come in and testify about, that's fine with us. It's just, for me anyway,
I just want.
I don't think anybody's gonna come, but.
Joshua Sachs here. I think we maybe could get a little bit better understanding about this independent contractor. If this is something that we have to make that decision, or can we continue on with the process that we're doing now? Or, because I don't really know what that answer is yet. Are we continuing on the path that we're doing, or is this mandated that we have to get a third party? Because it seems like we're still kind of looking into it.
Well, no, what the auditors didn't mandate. I have till October 18th to file what's called the corrective action plan, which each recommendation, I have to tell them where we're at, and we have a certain period of time to get in compliance. So if they're saying you either have to be, you have to, if their recommendations are these individuals, meaning the anesthesia evaluators, need to either be independent contractors, employees, or if we decide a third party, I have to let them know.
Yeah, same issue.
So how do we make that decision is my question is.
It's
how
not our
we-
decision.
Well, you would make a recommendation to the board.
It's this committee's, that's why it's on this agenda, because it's this committee's part in this,
Because you guys have the knowledge.
Because you have the knowledge of anesthesia and sedation and all of that as non-dentists and non-doctors, we don't. And also as evaluators, some of you have knowledge of what that entails. So that's why this is on here for a discussion such as that. Now, if you feel you need additional input from I don't know, someone, I forget his name, I apologize, Bart Johnson?
He passed away.
But he, someone like him, then you can ask to have the subcommittee reconvene for that purpose.
That purpose, and then maybe liability, maybe that's a major issue is the liability of this independent contractor. So that probably.
Well, I can tell you that the statutes are very clear that independent contractors cannot be covered under the state's general liability fund. Now, how that translates into what you need to do for yourselves,
You also have to have a business license.
you have to have a business license to be an evaluator. You have to have, you would have to make sure that your malpractice insurance covers the fact that you're evaluating people for licensure purposes. So now for someone who's retired and isn't carrying malpractice insurance, that will probably take you out of the game. For someone who is practicing and you do have malpractice insurance, you have to discuss with your insurer whether they would cover you for something like that.
May I ask you a question? I'm a little confused. We're talking two different things here. What's on the agenda when it talks about the scenarios and the different things that we need to perhaps modify to make them contemporary with current anesthesia regulation is one thing. Who does it is another. And I have a feeling we're mixing those two a little bit.
You are too.
I think we still, this is my opinion, need to go over the scenarios and bring them into compliance with what we need to evaluate, no matter who does it.
Correct.
And then if we end up hiring some company to do it for us, we can tell them, here's what we have gone over and said, we want you to evaluate for us if you come to work for us.
Correct.
You know what I'm saying?
Correct, and the way I was kind of seeing this is we weren't going to hire the company. So it's very much like the dental clinical exam. We accept, so the board can approve a entity.
Or
to-
multiple entities.
Or multiple entities to provide evaluation services. So we would not have a contract with them. They would just have to make sure that whatever services they're providing, that it's consistent with our.
What we say, yes,
Correct.
yeah, that's,
Correct.
I'm with you
And
on
then
that.
if they make any changes, then very much like ADEX and RED, it says, the language is that the board must approve the American Dental, the ADEX exam and the board, so you need both.
Right.
So if they were to make a change that you didn't
Well,
agree
even when
with,
Red
then
made
you
their
would tell
changes,
them we don't
didn't
agree with
accept
it.
all of their changes.
Correct. It'd be the same
Yeah.
way.
Twesmayer, one more question. Has this all come to you already in writing from Carson City about this independent contract? Okay, I always want to play the devil's advocate here, but down to the fact that you've been told to clean this up, and one of us goes out and does an evaluation, we have an adverse event, because you hadn't acted on it, am I going to be exposed?
You're covered. We paid for this
Okay.
entire year,
Okay.
whether we go a different route 2 months from now.
Okay.
We've made the payment for the entire year to cover everybody as they are
I'm
covered.
just wondering if that can be assailed from a legal standpoint and say, you know what, you shouldn't be doing that. I don't care if you paid the premium or not. You shouldn't be doing this. I'm sorry.
It's a good question. It's a good question. It's something I will look further into. I do believe you are not currently independent contractors. These evaluators have not been acting as independent contractors for decades, I believe. And we have been told from the General Liability Fund, the people from the AG's office who administer that if you are acting on behalf of the board, you should be part of that fund, and we have paid that. So, to the extent that anybody can name anybody in a lawsuit,
Yeah,
regardless of
absolutely.
whether or not it's legitimate, yeah, you can be named. Would you be covered? I believe so.
This is Joshua Sachs. Can you make the recommendations for us to continue on that fund, or that's?
We can only determine whether or not Deb and I can't, but the board can only determine whether or not they wish to accept or reject that recommendation of the auditors. If they accept the recommendation of the auditors, then we need to take action to implement the recommendation of the auditors. If they reject
But I think they already approved it.
I believe they did, yes. So.
The board approved it already?
Approved the recommendations. So we want to work toward complying with them, but we're in this legal conundrum that I don't know any other board has faced, because I don't know that other boards go out and do these evaluations. So.
My quick question is, so the board already did this, but we're having a committee to whether or not we're going to do it now. The board already did, that's what I'm confused
The
about.
board approved the recommendation from the auditors.
Correct.
They didn't, there hasn't been a decision made as to how we're going to do that. And
Right.
so that's what this is. How are we going to deal with the approval of those recommendations so that the board can protect the public through whatever evaluations the board feels is appropriate, but at the same time, make sure that we have people who are willing to do the evaluations that the board feels are appropriate, because, as both of you have said, if I'm on the hook myself, I'm not gonna do it, and I think that I think we're gonna run into that with a lot of people if we, when we approach them to say, we need to, you need to sign this contract and be an independent contractor, and here's the requirements for that. I don't think you're the only ones who are gonna say thanks, but no thanks. I don't need, this isn't my bread and butter, I don't need it.
So we're looking at another avenue.
Right, so
Should that happen.
Correct.
That we can still conduct the evaluations that are required in reg and statute. So that's why we're looking at whether there's other entities out there that could offer
Kevin Moore, I think that the,
Works in the current meeting. I'll push you on hold, and then when they're ready, I'll put you back on. Okay. Thanks.
Go ahead, I'm sorry.
sorry, I actually forgot my point. I apologize. It'll come back.
It will, they always come. You'll be at home tonight,
You
about
drive it
10.
home,
Yeah, it was the only critical thing I needed to say. We had a motion, sorry, but you had a question on the motion. Did you get your question answered?
I think so. Do we feel, I just want to make sure that what the motion wasn't a motion to have a private meeting
No.
that may not be appropriate
Public work.
under the OML laws.
Is there an issue if some of the board members would like to have some smaller committee or a larger group of part of the evaluators, have them included in a fact-finding mission and that sort of thing? You know, so that everything can be looked at all at the same time and more input?
I think that the
As
parameters
long as
that
we
you
make it a
have,
public meeting?
I think the parameters that you have to look at is whether or not there's deliberation, discussion, or decision.
I think what he's saying is, as part of the public meeting, can they solicit additional input from additional people?
Absolutely.
And the answer to that is yes,
Yeah,
absolutely.
Absolutely.
Right. And so the only question that you have is, what would we, if we were trying to establish a private meeting, what would that mean? So for edification for myself, what does that mean?
What do you, so this group can't get together in private and discuss what regulations you want to implement for the scenarios, or what the test that you want to implement for the scenarios are. Now, for the testing purposes, because it is a test and because the test itself is not public, we could probably go into closed session in an otherwise properly noticed meeting to discuss what the specific questions would be or what the specific scenarios would be, because that's not something, you know, that's a
So as long as we're not going to suggest that we change regulations in these items, then we can discuss it in a closed session.
as part of an otherwise properly noticed meeting. Am I getting this right?
Yes.
Okay.
If it helps the language, if you are preparing or revising an examination, you can go into closed session because the actual questions, the subject matter of that examination often has to be kept confidential, otherwise you're giving away the answers. So you could, as part of a meeting, go into closed session to discuss the details of the questions you're going to ask and basically what that test is. However, your regulations regarding who your evaluators are and the type of relationship that the evaluators have with the board, those issues aren't part of the test itself and would need to be done in open session. And we need a quorum of you guys at any point to have that meeting. But if as part of the meeting for the regulations or other aspects, you want to solicit additional public input or input from other individuals, you're always welcome to have more people attend and have additional comment from
All right,
people as part of your discussion.
So in a closed session, we could discuss our emergency scenarios, because that is the exam,
Yes.
correct? We could also discuss whether we need specific emergency scenarios for younger than 12, older than 12, that would be line
I
item.
think you can discuss, stop me if you disagree, Rosalie, but I think the discussion of whether or not you have a separate test or you have separate scenarios that's open. But once you decide that, yes, we're going to do separate scenarios, what those scenarios are can be closed because that's the test.
And then once you come up with the scenarios, I think you have to come back into open
Session.
to approve those.
Well, Kevin, would it be appropriate for us to make a motion at this meeting, because this is properly noticed, and anybody wants to say anything, and we can say that we make a motion, so to speak, say we would have two separate algorithms for under 12 and plus 12, and then we could go ahead with that. I would make that motion.
And general anesthesia is the third?
Yes.
We have 3 levels.
Yes.
So, I have a question, Deborah. Deborah, it's Amanda today. So in the past, we were given BART CDs, right, as an examiner. We would just watch the CD if we had questions about a certain medical emergency scenario. That was never handed out in an open form. That was just to the examiners, and it was just medical emergencies. So maybe I'm just confused on what needs to be discussed in an open forum, because if it's scenarios and it's in an open forum, then you're kind of sharing what the basically our questions are going to be, right?
That's why I made the motion. Yeah, that's why I made the motion, because we can discuss it privately, so that they don't get the content of the exam.
Oh.
So, once again, I'll make that motion again. The 3 separate scenarios, unless you have a better.
No, I have a point of order, because I thought we already had a motion on the
Wait, we
floor.
We did.
That we got to do something with that motion before we go to a new motion.
Well, we actually voted and passed on it, so.
No, I didn't have a second on it.
What was, can you tell?
I'll do it again.
Wait, on the first one, we're done?
On the first, no, yeah, on the motion that we just had.
Okay.
We went to vote, and I thought everybody was voting or had voted.
Which motion are you talking about?
Council.
But there was a question
Yeah, there
whether
was a
you were,
question.
because they were talking about the subcommittee and then adding other people, and we weren't clear if you were talking about, is this in a private?
Right.
Post that discussion, did we have a vote?
No.
Okay, so we're still on that motion.
If you want me to repeat it, I will.
Are you,
No.
are you,
Or rescind it?
You good with it?
You can repeat it, you can rescind it, you can amend it.
I will repeat it.
Wait, his
Or
motion.
amend it.
Your
I'm not
motion
amending.
came after the motion that they're talking about.
I'm saying his motion is out of order, because we haven't
Okay.
done the final vote on the one we're.
Okay, then I'm sorry,
No, there-
you're right.
there was a final-
Mike, I'm ahead of schedule.
There-
There
Yes.
was an all in favor.
yes.
Yeah, then there was post-discussion
Yes.
after the all in favor.
Exactly.
We did have,
Yes,
okay.
yes.
Oh, okay.
Good.
Okay.
Okay.
So what was that motion? Yeah, I'm sorry,
So,
just so
We all
I,
go to Disneyland.
now I couldn't get it out because I'm not a court reporter.
I was gonna ask you to
But I
say
do
this.
have, Dr. Kunde made a motion, so I do have to go back and get her verbatim what she said. There was a second by Dr. Twesme, and then there was a call for all in favor, any opposed, and there was none. Then you guys started to discuss because council had questions for clarification, which I did too, because I'm kind of.
I feel better now.
So yeah, so there was a motion, there was an all in favor, there was a call for any opposition, which there were none.
You're in order now.
Oh, I'm not so sure.
So yeah.
Well, that'll be a first.
I'm going to, so mine has not even been accepted
Thank you,
yet.
Ken.
We're just starting over.
But the motion that we had
Was.
I have to
was,
go back and listen,
to-
I couldn't type it that fast.
Dr. Kunde, if you remember exactly what you said or a good summary of it, I believe it was to put these items on a calibration meeting for further discovery. Is that a good submission?
That we tabled it until we have a calibration with the anesthesia committee, open or not, to discuss the updating the scenarios and such as part of the corrective action plan.
So, you wanted to make a motion?
No, I think she just made one, did she not?
Well, I think your motion
Was about the scenarios,
Was
It was about
about
scenarios, exactly.
Scenario.
having the scenarios that you, I believe, correct me if I'm wrong.
Yes,
that you
because we
moved
could do this in
to-
private because we're working on tests.
And when I say in private, I mean a closed session as part
Exactly.
of a
That's what I
regularly
meant.
scheduled
Yeah,
meeting.
yeah.
So, so I think your motion was to move to.
Develop.
To develop the 3 different categories of scenarios.
Yes.
Is that correct?
Yes,
Okay.
Yes.
for the exam.
I'll second that. Sanders.
Any further discussion on that motion? All in favor?
Aye.
Aye.
Any opposed? Motion carries.
It's a good one.
So that covers A and B. So C is the creation of a new calibration. So as she stated, Dr. Johnson, Bart Johnson was calibrated. Is that calibration still, I don't know, because I'm not a dentist, but is that?
So it's very outdated.
That's-
It's about 7 years old.
Correct. So that's why C's on here, whether you want to create a new calibration, if you want to designate someone, it doesn't have to be Dr. Bart Johnson, obviously it can't be him, but if you want to have
Second one.
some other general anesthesia member from this group conduct a calibration and
Any volunteer?
I would nominate Amanda.
Ted, I'll get you later. We actually just did a calibration for the American Dental Society of Anesthesiology for the new Emergency Act. So I actually already have it done. So everything's up to date as of this month, all the emergencies. So it's not going to be an onerous process. I don't mind doing it at all.
Good.
I
So
second
we-
Amanda.
what we've done in the past is then they conduct the calibration of the evaluators. We would videotape you so that whether they're independent, if we go forward with independent contractors, we have a calibration that anybody new would be able to review, to calibrate.
Fine. As long as there's hair and makeup.
So I just need a motion that you want to create a new calibration and who you.
Well, I'm sorry, Deb, not to
Okay.
interrupt you, but I thought that the motion that Amanda made was to have a calibration meeting that A, C, and D are all discussed. And so part of that is going to be her presentation for part C. It gives opportunity for those who have not.
I'm sorry, I interrupted.
No, I'm just saying, that's what I thought that it was. Was I mistaken?
Yeah, I think so. I'm not sure. I'm a little confused
That is the
myself,
verbiage
but,
she used, though.
but the
That is the verbiage that
calibration,
she used, yes.
the calibration, and I don't know where that term comes from, I just know that it's been used for a long time. The calibration is the training for the evaluators.
Well, I think.
So that's how that's how I've always understood the calibration to mean. So, so to the extent that there's a new calibration training that would involve these specific scenarios that you are telling the evaluators, this is what you're going to evaluate your evaluatees on.
We need scenarios first.
You need the scenarios first. And then you can do the training. The training is not part of the board
No.
open meeting issue.
Right, but what she has are current regulation recommendations that we should look at and understand so that we develop the scenarios to match the current.
Okay, then I misunderstood what it was that Dr. Okunde had said that she's already developed. I understood that, am I incorrect in my understanding that what you have recently developed are the various scenarios?
So what we would do, Deb, is we would take each of the scenarios that we already have. So let's, for instance, bronchospasm. We'd all discuss what the current literature says about how to treat it, and then we're going to break it up into 3 different areas of evaluation, from oral moderate sedation, IV sedation, general anesthesia, and take that one scenario and apply it to each of the different new regulations that we have. That's all.
Yep,
Yes.
good idea.
Okay.
That's very similar to what Dr. Johnson, Bart Johnson did when he came.
Yeah, exactly. So we're just going to take each of the medical emergency, we're going to break it down all together as a group, we'll talk about what the recent information says to make sure we're on the same page. That's where the calibration comes from. And then we're going to apply it, like Josh said, to a ped sedation, oral sedation, so on and so forth, so that we're all on the same page when we're going through the scenarios. And like you said, we can change it once we're all on the same page on how to treat it and change the age if we needed to make it more applicable to whoever we're examining.
So would that be
So what you do is you-
development of,
So it's the calibration. So basically, you'd start the meeting, you'd go into closed session, you do the calibration, we'd film it for other potential evaluators. But once you get the scenarios and it's all developed, then you have to come out. You have to come out of closed session and then say, okay, these are the emergency scenarios we're going to recommend to the board. And then all that documentation and so forth would be confidential, but you have to bring those recommendations to the board for them to adopt those scenarios as the scenarios used by the evaluators.
Wow.
That's how it goes.
Wow.
Well, but
So
that's
the
not
only
all.
other issue though is a lot of these things change often, whether it's American Heart Association, whatever. So a lot of the ways that we treat these medical emergencies change. So our scenarios are going to change depending on what the new literature is. So every single time we change something, we have to bring that before the board to be adopted before we can then use it in our examinations.
Yeah, so you would basically contact the chair of the anesthesia if they're not aware and say, okay, these are the new, you can do it every 6 months or once a year. You bring any changes to the committee, and then if they agree, then they make a recommendation to the board, and then they update the scenarios or update whatever.
Okay.
Wow.
It's easier than it sounds.
Yeah, I think so.
It is.
Well, and I think there might be confusion that that might be 2 meetings, right? The meeting of the anesthesia people, their closed session, that all might be all at the same time. But then that information goes to a recommendation to a full board, which would be a different meeting that, or
Correct.
it could be the same day, but it's a separate meeting, not the anesthesia committee.
Correct. You could
Yeah.
hold your meeting if you want. You could hold your meeting in the morning, and then if the board wants to hold their meeting in the afternoon, then I'd put those, you would let me know ahead of time, we're gonna have proposed recommendations. I'd put it on the agenda, and then the board approves it. Once the board approves it, then that calibration then would be disseminated to all the other members or any member who didn't come to the meeting, and that would update them on all the changes.
and not to throw another wrench into this, but there is the ability for the board as a whole to delegate to this committee the authority to make those changes. So if that is something that the board as a whole wishes to do, so that that last step of bringing recommendations to the board to alleviate that one step, if that's something that you feel is beneficial to get things going quicker or to avoid further, whatever reason, if that's a recommendation that you'd like to make, that's something that can be discussed by the whole board as well, whether or not they just want to delegate this authority to this committee.
So if you want that on the agenda for November 1st, then I can put that as an agenda item.
Yeah. So that's another option for you.
We're just full of
All you independent contractors.
fun.
All right, well,
They don't like
are we satisfied then that agenda A and B and C and D are going to be put on a second meeting as the motion went?
That's what I thought we did.
I thought that's what we did too.
Yep.
All right.
Well, I think they need to know.
Right.
Right.
So,
So
Under agenda,
Under Agenda D, since we have the
Did you get A, B,
AA,
and C all good? Are we
Yes.
all clear on those? Those are all going for our next meeting.
correct, you would let me know
Okay.
when you want
Yeah.
to conduct it. If you want
Yep,
other evaluators
right.
there, then we can, it's a public meeting, but if you want me to invite specifically the evaluators and see how many we can get here so they can.
Dr. Johnson, Dr. Akunde, I believe that was the intention was to possibly invite all the evaluators to that next meeting.
I think that we have to. And, just in case Sandra can't find someone that day and she has to use someone that is not usually on the anesthesia committee or not usually helpful, that everybody, as we've been saying, calibrated. So everybody who wants to be an examiner has to be at our
Yep.
meeting to calibrate.
Yes.
Yeah,
Yeah.
good. All right, and so now do you have,
And then that way we also can clean up that list kind of for people who have moved or who are not helping, we can clean the list up. That way actually Sandra knows who actually can help us.
perfect.
Yeah.
All right, so council, you have a question on D, item D?
so under item D, one of the companies that does this has offered to make a presentation to this subcommittee to explain what services they could offer should you wish to consider moving to an outside company. So they're on the line.
They're on the line and they have a webinar